my name is Dr Marlain Mubarak. I'm a consultant gynecologist with special interest in endometriosis, laparoscopic and hysteroscopic surgery, as well colposcopy and other gynecological problems. Endometriosis is a problem that affects 1 out of 10 women. It's very common. It's basically tissue from the lining of the uterus found outside. It can be on the ovaries, it can be on the uterus, it can be on the bowels, and in other areas inside the tummy. It affects women's life, it affects the quality of life, and it's really difficult to diagnose. And interestingly, many women would see between 4 to 20 gynecologists before somebody tells them the problem that you have. The cause of all your suffering is endometriosis. It can be pain that starts a day or 2 before the beginning of the period. Once the period starts, the pain becomes worse. It can be heavy period, bleeding in between the periods, as well low back pain. When there's endometriosis in the bowels, typically women will have like diarrhea or constipation at the time of their period, pain when they open their bowel at the time of the period. Many women, their pain starts from the time their period starts. And many women have to go to the emergency department to have injections for pain relief every time they have a period. And some even end being admitted to the hospital for pain management at the time of the period. Some other women will describe that they have bloatedness when they have a period, and when they are bloated and the tummy doubles in the size, the pain is really, really bad. Studies in Oxford had showed that endometriosis is genetic. A lot of women would say, I have nobody in my family who have endometriosis. The reason for that, because it's difficult to diagnose. And if you start asking, you will find your mom had a period problem, period pain, your aunt, your sister. So we believe it's interaction between our gene, the environment, our way of life, and that's the reason why some women get endometriosis. Stage 1 is minimal, stage 2 is mild, and stage 3 is moderate, and stage 4 is severe. Depends on how many organs are affected and the extent of it. The pain tends to get worse the more severe the endometriosis is. And what is interesting, endometriosis progresses with age, and we tend to see the stage 3 and stage 4 more after the age of 30, 35. And that's the time when we see these severe endometriosis cases. The endometriotic tissue itself releases the hormone estrogen, which basically allows it to grow. So imagine if you have a plant and you stop watering it, it will shrink. Endometriosis needs estrogen. So part of the treatment is medical. The medical treatment is all hormonal treatment and mainly contraceptive treatment. And they are focused on lowering the amount of estrogen produced by the endometriotic tissue and getting it to shrink. However, if we want to be honest, there is no treatment for endometriosis as getting rid of it. Like if you have infection, you will take antibiotics, it goes away. With endometriosis, we manage it. The other option is surgery. The surgery is laparoscopy, as excising all the endometriosis. For the surgery to be successful, it has to be radical, as we have to remove all the endometriosis. Otherwise, it's better not to do laparoscopy to remove the endometriosis. Still, after surgery, we know endometriosis comes back, sometimes after 6 months, sometimes after 2 years. So we still need to combine surgery with medical treatment. The chances of a woman getting pregnant, every month she's trying to get pregnant, if she doesn't have endometriosis, is 15%. However, women with endometriosis, their chances of getting pregnant every month is between 2 to 5%. So the answer is yes. Still, some women without any treatment to endometriosis, without any surgery, can get pregnant. It might take them long time to get pregnant, and unfortunately some of them lose the chance of having a baby. It's actually age. Endometriosis is a chronic progressive disease. It's benign, it's not cancer. It affects women's life, same as cancer, if not even worse. It affects the quality of life. Women unable to function, unable to go to work, and we tend to see the severe endometriosis usually after the age of 28, 30. So it's a progressive disease. Interestingly, women who have period pain from the time they start having a period, we find later on 75% of them have endometriosis. Having period pain at a young age, ideally we should start medical treatment, and there is a lot of different medical treatment that we can choose. Using the contraceptive pill, whether it's the progesterone only or the combined, it helps to improve the pain, but at the same time it stops the endometriosis from getting worse. That's the one thing that helps us. It's a progressive disease. It depends on the location of the endometriosis. With severe endometriosis, what we find endometriosis around the ureter, which is the tube connecting between the kidney and the bladder. Sadly, 2% of the women end with damage to their kidneys. If there is a lot of endometriosis on the bowels, some women can present as an emergency to the surgical team actually with bowel obstruction or bowel perforation, needing surgery as an emergency, and then we discover they have endometriosis. If we discovered it early, diagnosed it early, managed it early, it means we can stop these women suffering and having incomplete surgery, and as well losing the chance of having a baby. The hysterectomy might be an answer, but it should be part of a complete surgery removing all the endometriosis. Sadly, I see a lot of women who had partial hysterectomy. Their pain is even worse after the hysterectomy than before because they didn't have the complete surgery. And then trying to sort this out is really difficult. Surgically is difficult. However, we have really good result. I've removed the cervix and treated all the endometriosis for some of these women who had hysterectomy. I always say to my ladies, the first part of the treatment is actually knowing what do you have, the extent of the disease, and then we can tailor the treatment according to your age, what you are trying to achieve. And there is always more than one way of treating women. So it's not only surgery. There is other options that is relevant to each woman as we are all individuals. In a very small number of women, the endometriosis goes away by itself. So most, it will either stay the same or actually gets worse with age. Lifestyle changes help, such as exercising, because exercising help us to produce the natural painkillers, the endorphin and the natural morphines. That helps with pain management. Interesting diet. Staying away from inflammatory type of food, such as meat, chicken, gluten, helps some of the women. And I have few patients actually who became vegan and their pain had significantly improved. However, I would still say that these women are as well on medical treatment, and these women are women who had surgery before. So yeah, lifestyle and diet can help, but it can't get rid of endometriosis. A lot of women had been told, go and get pregnant and the endometriosis will go away. It doesn't. It's a myth. It's not a reality. Some women with endometriosis in pregnancy, their symptoms becomes worse and they are really difficult to manage. However, pregnancy for endometriosis is like taking the contraceptive pill for 9 months. It helps. The moment you have your baby, everything goes back to square one. So the pregnancy have no negative influence in the endometriosis, neither any positive impact on the endometriosis. The answer to that is no. Endometriosis does not affect the baby whatsoever. Endometriosis does not increase the risk of the woman having abnormality in the babies, but women who have endometriosis are at higher risk of having a miscarriage in the first 3 months of pregnancy, are at higher risk of having a second trimester miscarriage after 20 weeks, as well preterm labor. And one interesting point, 60% at least of the women with endometriosis and with cesarean section for obstetric reasons, as the baby still stays sitting in breech position, or the woman gets stuck in labor. And that is on comparison to only 20-25% of the women end with cesarean section. The reason for that, we still don't know. What we set up in King's is a multidisciplinary approach. When I see the patient, I take a full history, specific history for endometriosis that gives us an idea of the extent of the disease. I do ultrasound in the clinic, or I ask my radiologist who is experienced with endometriosis to do ultrasound for them. And then we move to the next step, which is MRI. The MRI gives us a clear picture of the extent of endometriosis if a woman has severe endometriosis. Part of our team is gastroenterologist, because women with endometriosis suffer with bowel symptoms and they have irritable bowel symptoms. If you manage the endometriosis forgetting about the irritable bowel symptom, they don't improve. If they have bowel endometriosis, I work with Dr. Ali, the bowel surgeon, to remove all the endometriosis surgically. And this multidisciplinary team approach, that's what makes us quite good in diagnosing the endometriosis, as well as managing these patients with excellent result and excellent outcome.